If you, a member of your family, or someone you care for has been referred to a speech pathologist, you may be wondering exactly what speech pathologists do. This video will give you an overview of the speech pathology practice in Australia and the frameworks that govern the profession. Speech pathologists are university trained health professionals specialising in communication and swallowing difficulties. They work with clients throughout the whole lifespan, from newborn babies right through to old age. Speech pathology covers language, which includes reading, writing, memory and comprehension, assisting with speech difficulties, swallowing, treating conditions that affect the quality of the voice, fluency or stuttering, and multimodal communication. That is human-computer interaction that assists people communicate. Speech pathologists work with people experiencing a range of communication difficulties, resulting from developmental delays, strokes, brain injuries, intellectual disability, cerebral palsy, dementia, hearing loss, or other factors. They may work in public or private practice and can be based in schools, hospitals, aged care facilities, mental health services, or community health centres. They sometimes work in a team with other professionals such as occupational therapists, dietitians and psychologists. In Australia, speech pathology is governed by three frameworks. The first is the Code of Ethics established by Speech Pathology Australia. This code ensures that speech pathologists display professional and ethical conduct and establishes the values, principles and the standards required. These include respecting the confidentiality, safety, rights and dignity of clients, not discriminating, professional integrity and providing accurate and timely information. The second framework is the International Classification of Function, Disability and Health, or ICF. The ICF provides a holistic approach to treating clients. It recognises that health and well-being is more than just not being sick. It is about each individual being able to participate in society and in the activities that are important to them. The third framework is the Competency-Based Occupational Standards for Speech Pathologists, or CBOS, which sets out the minimum skills and knowledge for new speech pathology graduates. As well as more specialised skills, the CBOS states that graduates should have the general competencies of reasoning, communication, professionalism and lifelong learning. The ICF and the CBOS also require speech pathologists to make treatment decisions using the best available evidence and to consider variations between different cultural backgrounds. Under the ICF, speech pathologists develop treatment plans centred around the client, taking into account their health, physical and emotional well-being, education, employment circumstances, social circumstances, and the amount of support available from family, friends and caregivers. This is Gary. He is 57 years old and works in a bank. In his spare time, Gary loves doing crosswords. Driving home from work in winter, Gary is involved in a car accident and sustains a mild to moderate head injury. After the accident, he experiences fatigue, headaches and poor memory, as well as some speech difficulties. After leaving hospital, Gary and his wife visit a speech pathologist. The speech pathologist finds that Gary is having difficulty with memory and learning, as well as speech difficulties. They work with Gary and his wife to develop a client-centred treatment plan as specified by the ICF and CBOS. Gary is provided with some mental exercises for focusing and maintaining his attention, as well as some conversational communication strategies which he can work on at home with the help of his wife. Over time, and in regular consultation with his speech pathologist, Gary has improved speech, less headaches and more energy. He is able to attend work and do crosswords again with some modifications. Speech pathologists work in a variety of settings and assist people with a range of communication and swallowing difficulties to participate in society and undertake the activities that they enjoy. For more information on speech pathology in Australia, please see www.speechpathologyaustralia.org.au or phone 1300 368 835 or email office@speechpathologyaustralia.org.au.